Awesome. Yeah, I'm going to pass it on over to you guys. Thank you so much for being here.
Thanks for having us.
Well, the last time we did this, Doug and I got together for a local first talk to talk about paid sick time, Prop 206. And so, Doug and I still work together. And what we thought was, with everything going on, post-lockdown, DUSI, easing orders, et cetera, we thought it'd be a good idea to get together, talk about what he and I both dealt with, myself from a legal perspective, Doug from the practical aspect of reopening a restaurant, rehiring a staff, firing a staff, all of those things, unpleasant things that none of us have ever gone through before. And so we think the time is of the essence on this. As Melissa was saying, we do intend for this to be very conversational. This is an odd thing to do, a webinar. I only see Doug's face right now and he sees mine, but we know there are others listening, of course. And so what we want to do is, we've got a very rough outline we're going to follow, and it's kind of broken up into various sections. What we'll do is either Doug or I will punt to the audience and say, what questions does anyone have? And we're happy to field those. We do want it to be conversational. I'm thinking back to the Prop 206 talk when it was really engaging, and a lot of heated questions, and people are concerned, and this is the livelihood of everyone's business, and we're sensitive to those issues. So as far as questions go, happy to answer any questions. One thought I had, just to keep the conversation moving, if anyone has what I would call a hyper detailed question on PPP or loan forgiveness or unemployment benefits, et cetera, I'm happy to answer those, and by all means ask, but it may be something I say, ask me offline. I'm happy to answer questions. Obviously I'm not going to charge anyone for my time. I want to help. And so if you want to email me at matt@mattandersonlaw.com, with an S-O-N, matt@mattandersonlaw.com. And I think Melissa will send around contact info as well. I'm happy to consult with anyone on that stuff. So for detailed stuff, let's do that. But otherwise, by all means, ask any questions you have. So this is titled Avoiding Litigation. So, and I would broaden that to best practices in reopening, some of the experiences Doug has been through, some of the things that we're dealing with in the office. What I will tell you is, from a litigation perspective, and just, I guess, by way of introduction, we're a boutique law practice. We represent small businesses in employment matters, litigation, transactional, everything in between. So the things coming across my desk are claims from employees that they've been wrongfully terminated or retaliated against for either voicing concerns about COVID or being laid off for reasons they believe are inappropriate. We have had the occasional customer complaint. It hasn't risen to a lawsuit yet, but I got COVID, or I have a family member got COVID. The only thing I did was come to your restaurant, come to your retail facility, come to your place of lodging. It had to have been you. And so, just as a general premise, we are in uncharted territory, not just from a business operational standpoint, but also from a legal standpoint, establishing causation, establishing where someone became sick. And part of the reason for this talk is best practices, of course, are the right thing to follow, the right thing to do. Everyone would agree with that, but why are we doing that? One is perception that the business is being safe, taking care of its employees, taking care of its customers. That has the practical impact of reducing exposure, reducing litigation, reducing complaints. That also, has the effect, we hope, of reducing infection rates. Everyone wants to flatten the curve, and this is a very timely issue because the curve is not flattening, especially where we are now. That's very concerning. My office is back open for business. Everyone's here. Doug, I think, is getting there as well. But we're on, do we push the pause button now? We don't know. And so the things that we can control are our policies and procedures, and how we're treating employees, how we're treating customers, what we're forcing people to do. It's uncomfortable for some, but and everyone deals with this differently. So I don't want to suck out all the oxygen in the room. Doug, do you want to share some of the what I would call sensitive issues maybe you've been dealing with and can share your experience on?
Sure, no problem. So when COVID started, March 15th, I think that was like the day for most restaurants to figure out what they were going to do. And, at the time, we were projected to have some of our best years that we've had at both restaurants, only to come to a standstill. And we had to zig and zag. We made a decision, and I didn't make this decision alone. One of the things that I've done from the get-go was, I rallied behind my team and say, hey, this is what's going on. How do we do this? And kind of allowed myself to be vulnerable with my staff and say, hey, I don't have the answers. I only know what I read and from what I've seen. And but we have to make some decisions. And we, right after March 15th, we made the decision to shut both restaurants down, which was for me extremely difficult to all of a sudden make a decision to lay off, 68 employees, some of them who had been working for me for over 10 years. So at that point, we had to just figure stuff out, shut things down, talk to my landlords, and try to mitigate the loss. So for us, we're a small company. We don't have corporate backing, and we're literally a mom and pop operation, and so we have no safety net. So we really shut it down and try to cut the bleeding as much as possible. And then we applied for the PPP loan and zig and zag through that process to the point where right around April 15th, I stayed in contact with the team and we reached out to them and say, hey, we're ready to get back and start doing takeout. And at that point, that presented in itself some problems because most of my staff didn't want to come back. So then, and I spoke to Matt quite a bit about this stuff as things came up, which to me it's an awesome resource to have is to really reach out to people that are in the HR world and utilize those outlets to make solid decisions. But I did not take any action against any employee that didn't want to come back, even though I've offered them the jobs back. I just felt that, hey, at this point, let things be what they are and just focus on the people that do come back. And we had to make it fair for them because, at the end of the day, they're getting paid, $840 a week from unemployment insurance with the $600 credit. And we couldn't compete with that. So we, fortunately, the PPP loan that came through, we were able to at least stay competitive with being able to get people off of unemployment and put them back to work, subsidizing their income with that PPP loan, as well as being able to bring back all my cooks. A lot of the cooks that work for me, are Hispanic. Most of them are either work permits or dreamers. So a lot of them couldn't collect unemployment. I kept a lot of those guys and gals, on payroll until we could, get back in there and start doing stuff. So that's a little bit of what I've done so far. But I don't want to hog the audio, so I'm going to give it back to Matt.
Well, I've got a couple of questions for you on that, Doug. So with the expansion of the forgiveness period on PPP going from 8 weeks to 24 weeks, has that changed what you do, how you do it, how you spend money, how you plan for staffing, et cetera?
Yeah, I did. I think that when we got the PPP loan, we're super excited, but then all of a sudden we have to use 75% for payroll, and then you're looking and going, I can't even get my staff, my 100% of my staff back. So at that point, I just made the decision. I'm gonna just, use it as I need it. I am not gonna just go ahead and spend the money just to spend it. So I was really happy to see that they loosened up that aspect of the loan to 60%, which ironically is where we were with our staffing, was right around 60%. So automatically we fell in line with those things. And the reality is that PPP loan, we have some cash reserves, and when it comes down to do the numbers, I'm hoping that we can give the money back and be okay. But the biggest question for me right now is that we're talking September being another wave of Corona. How is it going to affect the hospitality business? How's it going to affect other industries? So to me, I'm just playing the most conservative game that I can right now in order for us to weather the storm, because like I said, so far, there's been a lot of zig and zagging, and I don't think we're done. So I just want to be ready. So I've been very conservative about cash flow and how we employ people back. Just because we have the money doesn't mean like we're going to just bring everybody back and hope for the best. We've taken the slow road as far as the takeout, and we did do a lot of social distancing in our restaurants. We separated all the tables to be 6 feet apart from each other everywhere in the restaurant, as well as implemented a lot of safety measures for guests to feel comfortable.
So I want to come back to that, the individual safety measures, because Doug and I spent some time on the phone earlier this week, and I know his safety measures are impressive. So Doug, I want you to share those in a little bit. But I think what you raise an interesting point. Doing the right thing versus doing the legal thing can often be different when it comes to challenging unemployment benefits, when it comes to challenging paid sick time. A lot of our clients who are small businesses, if they can afford to do so, have elected to pay a few extra $100 here or there if it's going to avoid a retaliation claim, if it's going to avoid investigation by DES, if it's going to avoid Department of Labor coming in. So yes, I think it's arguably the right thing to do depending on the circumstance, but also it's establishing a familial, collegial environment. I mean, you refer to your Gallo family, Doug, and I think a lot of the small businesses locally feel the same. I know we feel the same here. So the other thing I would add to that is, this conversation is happening when we've got current guidance from Department of Labor, but it's changing. CDC guidance is changing. We've got a president not wearing a mask. Do we have to enforce mask wearing? I mean, it's kind of all over the place. No one knows what to do. The question I get most often is, I want to reopen. I need to feed my family. How do I do it? How do I do it safely? And so when we talk about best practices, policies, and procedures, we have to talk about it both in terms of employees and in terms of customers. And Doug, I know you've got unique considerations and concerns related to the restaurant industry that maybe lodging doesn't have, or that maybe different retail space doesn't have. But I think first and foremost, from a lawyer's perspective, whoever you are, no matter your size, one employee, no employees, if you're public facing whatsoever, you need to have a policy. Meaning, well, you should have an employment policy to begin with that includes paid sick time, but you also need to have a COVID response or COVID prevention policy. So what are you doing in the way of sanitation, in the way of enforcing social distancing, in the way of enforcing mask wearing? Do you want to? Will your employees show up if you're forcing them to wear a mask? Do you want to have a different policy for front of house versus back of house? If you only get employees by appointment, or I'm sorry, customers by appointment, does that change your practices? So, the first thing I would, for everyone listening, you got to have a policy. I don't care who prepares it. You can pull them offline. Our office prepares them for our clients, but it's got to be tailored to what you do so that you can actually follow the policy. Because the last thing you want to do, if I'm a plaintiff attorney suing a business, the first thing I want to know if there's an injury or an illness is, did you have a policy and did you follow it? So the only thing worse than not having a policy is having a policy, not following it. So you got to be able to follow it. So I'm not suggesting that everyone close down for 3 months while you clean the restaurant and while the curve flattens, but you got to be doing something responsible to prevent exposure to complaints, litigation, and we haven't seen the litigation come, at least not in the wave that we expected in the future. So now we're in the planning phase. We're in the phase of doing everything intelligently while we learn more about the virus. How is it contracted? You'll hear different things from many different people about the risk of exposure. So, again, I talked about causation. So any claimant is going to have to prove more likely than not that they contracted it due to exposure at your restaurant or your place of business. That's very hard to prove. In the same way that a work comp claim related to COVID-19 is going to be very difficult to prove that someone contracted it on the job while in the course and scope of employment. So that's incredibly tough to prove. But as we learn more about the virus, that a claimant can drill down on those causation facts. And so that's why at this point in time, everyone has to be incredibly careful about what they do, how they do it, staying in contact with employees, staying in contact with customers. And that's why Doug and I were talking about this. For everyone's you don't have to publish your internal policy to customers, but you should have some kind of blurb, whether it's outside your business or immediately inside, whether it's on a poster board, something advising people what you're doing, the measures you're taking to ensure customer and employee safety. So, you can't go wrong with those things. And in my opinion, that's best practice.
So some of the things that we did, when we were, okay, we're gonna reopen. So I grabbed all the management team, and we went through a lot of websites, Maricopa County, as well as the National Restaurant Association published some documentation on how to operate with COVID-19. So we got the manager certified to be COVID-19 training, and we went through and implemented the systems that we needed. So we have a temp log. When people walk in, we take their temperature. We ask them the questions. Hey, have you been sick in the last, week to 2 weeks? Has anybody in your family? So we ask those questions on a daily basis, and we document it. As well as we have a hand washing log where, the managers go through every 20 minutes and they make sure that the staff has washed their hands, and if they haven't, we make them wash their hands. But a lot of the other things that we've done too is we reached out to Maricopa, the health department, and had them come in, because they'll come in and if you request to have them come in and look at your operations, they will do that, and they will tell you, hey, you know what, you got to fix this, or this is not right, or can I see your documentation for this and that. And so it's good that we actually can do that with our health services. You can call them and they will show up and give you a rundown to protect yourself, because if they come in and they fix a lot of the stuff, then if something does happen, at least you can document that, hey, this is the stuff that I did. Another thing that we did with our policy, because once again, a lot of my staff has paid sick time. So we said, look, if anybody's not feeling well, whether they're running a fever or whatnot, don't come into work. Call us. We'll cover your shift, and use your paid sick time. If somebody has used up all their paid sick time, then, we'll say, hey, you know what, we're going to cover you, and we don't want you to lose income, so stay home. Because for me, the cost of paying somebody to stay home is going to be a lot less than if they come in and all of a sudden you have all these people, get sick, and then all of a sudden, hey, Otro Cafe's got an outbreak on coronavirus because, so-and-so came to work and they didn't manage it. So we're doing our best. And once again, a lot of the stuff, you can do all you can do, but there's just that unknown, and there's always risk in anything that you do. So.
And Doug, that's excellent that you're getting your managers certified by the health department and having them come in. So from a legal perspective, that's a great way. Not only is it the right thing to do, I would say, but also it's a prophylactic response to help insulate yourself from future claims. So let's say hypothetical guest, this isn't going to happen, of course, because, Doug does everything the right way, of course, but 6 months from now, let's say, customer complains against Gallo Blanco, files suit, whatever they may do, and says, listen, I contracted COVID there. I was in the restaurant and a server walked by me who didn't have a mask on, and he was standing next to my table for 15 minutes, long enough for me to contract it. And furthermore, I said, I'm uncomfortable with you not wearing a mask, and then I left. And then, then I got COVID. Well, Doug can say, well, number one, look at our, his defense would be, here's our policy, check it out. Here is the, which requires mask wearing. Here is this employee who signed off on the policy, understanding the policy. Here's evidence that we had the county come in and review our operations and, give us a, gold star. All these things you can do to paper your internal files to defend against these types of claims, because we have to, small businesses are an easy target, or a better argument is their insurance policies are an easy target. And so when people get sick, they're looking for someone to blame typically. That's going to happen. And so all these things that you're doing now, Doug, are absolutely the right thing to be doing, and everyone should give that some strong consideration. So we've been going for about 25 minutes or so. Doug, you want to take some questions?
Yeah, anybody has some questions, let's throw some out there.
Melissa, do you want to start by reading the question that came in earlier?
Yeah, and I actually have one that was privately sent to me as well. So I'll ask that one first because it pertains to the conversation before. So this is for Doug, and she asks, are you subsidizing staff pay for a period of time, or did you give permanent raises to staff to compete with the unemployment rate?
So that's a great question. So what we determined was that we will subsidize the income of an employee to match that of what they were making at unemployment. So for example, right now we pay everybody, tipped employees, $10 plus tip. Now, if there's a shortfall of tips that they do not make above $21 an hour, because that's what we broke it down, 800 a week, 40 hours, like $21 an hour. So if they were below that, then we would subsidize and make sure that they reach the minimum of 21. Now, ironically, people, since we've done takeout and now last week we started doing a dine-in, they're people being very generous. So we have not had that issue. But to answer your question, yeah, if there are some employees that like in the kitchen that were getting unemployment, and we match the $21 an hour. Now, there is an expiration of that. What we did say is that we will honor that until July 31st, because July 31st is when the payroll program with unemployment will go away, unless they extend it, and then we'll cross that bridge then. But that's what we're doing currently.
All right. So the next question is a little bit lengthy, but this one is actually sent before the presentation even started. So this is from Dos Cabezas. Says, thank you for setting this ahead of time because gave Matt a chance to kind of look over it beforehand. So it says on the registration page for President Donald Trump's campaign rally, in which the registrant acknowledges a hold harmless agreement should the registrant contract COVID-19 at the rally. Generically, are hold harmless clauses such as this legally enforceable? As a lodging facility, can I place a COVID-19 acknowledgement that the guest making the reservation agrees to hold us and our business harmless should they contract COVID-19 at our business or during their stay? Do you want me to ask the second question, or do you want to go ahead and answer that one now, Matt?
Why don't you ask the second, then I'll kind of recap a little bit. How about that?
Awesome. Okay, second question is, what is our liability should a guest arrive or become sick during their stay? We state on our COVID-19 page on our website cancellation requirements, and if they show up or become sick, we will charge them for the full reservation.
So these questions are not necessarily unique to lodging. I guess if someone someone's not staying at Gallo Blanco as long as they'd be staying at a hotel. So there's that difference. But these are questions that all businesses are facing, but this is a little bit unique to lodging, and it's a great question. So hold harmless agreements. I mean, everyone has signed, maybe not everyone, being presumptuous, but at some point, most people have signed a waiver at a gym, for an example, saying, you assume the risk of injury by doing these things. And if you read in the fine print, it says, you also agree to hold us harmless. I generally sign those without thinking twice because they really don't matter. They are some evidence that someone entering your facility has an awareness of what's going on. And of course, this is different if you're driving a race car versus, going into a lodging facility or a gym. In that sense, a hold harmless waiver does carry much more weight. But basically, you're asking someone to consent to you being negligent, which is legally unenforceable. So I would say, to be specific and answer the questions, I would say, can you, as a lodging facility, can you place a COVID-19 acknowledgement in your paperwork that a guest agrees to hold you harmless? You could, but I wouldn't. Number one, because I would argue it's not enforceable. Number two, it might be poor form. Number three, meaning I would be a little alarmed if I were a guest reading that. Number three, I think a better option is to put in, a policy and procedure like we were talking about of, listen, I acknowledge by initialing here that these are the things that this lodging facility is doing to help ensure my safety and the sanitation of this establishment. So, all the cleaning you're doing, what the employees are doing as far as distancing and wearing masks and washing hands, et cetera. So I think you would protect yourself more and reduce your exposure more by having a guest initial this policy. And as a matter of fact, we have some physician clients and dentist clients in the office. We have them put this policy in their intake paperwork. And so the patient is acknowledging all the things that this office is doing. And part of it is, when we're all just as a human being, we're all venturing out back into the world now. We're kind of tiptoeing and, dipping a toe into the business. We're entering the door. We expect to see something different, right? It should look different. And if it doesn't, maybe we're alarmed. And so you're taking it head on by saying, listen, this is what we do. And then you're also saying, by the way, initial here, so that if this guest comes back and does sue you, you can say, yeah, but you acknowledge we are doing all those things. You have no evidence we weren't doing these things. What's the basis of your claim? So hold harmless, I'd advise against it, understanding I'm not giving legal advice. These are just recommendations, of course. Second question, what is our liability should a lodging guest arrive or become sick during their stay? Well, that goes to the causation component I was talking about. So if let's say they have video evidence, let's say they've got a video that shows all the guests lined up at registration, a foot apart, people are coughing. You've got your registration employees, a couple feet away taking information. There's no mask, no partition of any kind. If they can show irresponsible behavior, I think they still have they would have a tough time establishing, more likely than not, because we don't know where COVID is, right? That's the key. But if they can establish, more likely than not, that they contracted COVID at your place of employment, sure, that's a claim. And they can, of course, file a claim. It may not be successful, but I think there's some exposure there. And that goes to best practices. So we're talking prophylactically, what can you do to reduce the likelihood that happens? And so as far as other questions, Doug and I'll keep going with questions. So if you want to, we can do it one of two ways. Sorry if I'm repeating this, Melissa, but for everyone watching, you can unmute yourself or take off the video, whatever you want, so we can see you, hear you, ask your question, or drop a comment into the chat. I don't know how to do that. If you can figure it out, please do.
I do have one more that was sent to me. So this is for Matt, Matt. It says, we have a contract with an organization that provides contract employees who work with us. What do we need to do to protect ourselves from being liable for potential exposure to coronavirus?
Well, that's a good question. Because a contract employee could argue they're a shared employee, and that both the principal and the place of location are both liable for any illness. So what I would do is, you're really going to treat those employees like you would treat any other if they were your actual employee versus from a third party. So if you want to take temperature checks, we're in a pandemic. There's case law that says a temperature check is a medical exam, or medical testing, I should say. Ordinarily not permitted, but in the case of a pandemic, which we're in now, it is permitted. So, I've been places where my temperature is checked, and furthermore, I have no problem doing that. So you could treat those folks exactly like you would if they're your own employees. I suppose, I don't know what the turnover is, how often you're getting new employees from this third party, but if you're getting a regular influx of new employees, I would call this, I don't know if it's a staffing agency or what, but I would call them and say, listen, are you doing screening before you send people over to me? If so, what are you doing? Get it in writing. So, one thing we deal with often is conversations are often not reduced to writing. And my paralegal sitting next to me knows how often we confirm things in writing, because if it's not confirmed, it didn't happen, at least in the eyes of the law most often. So I would find out what practices the staffing agency is going through, and then you're gonna have these new contract employees do what you would have any other employee do. So the washing of hands, I don't know what kind of facility it is, but washing of hands. I would say face masks, and again, then the type of face mask. So there's the N95, there's surgical, there's cloth. There's studies showing that you've got to have something like 17 layers of cloth to achieve the filtration properties of an N95 or something close to that. So standard of care on the type of mask. So we could go on and on, but the key is that you're doing something responsible and you're documenting it. So I hope that answers the question.
Perfect.
There's a couple questions in the chat.
Yeah, there are some coming through. Did you want me to read those? Do you want to read them, Doug?
Sure. Are there any repercussions should a customer not agree with our policies? So we have not had this instance yet in the restaurant, but what we with our management team, what we said was, look, if somebody comes in and they're sneezing, they're showing respiratory symptoms, then I think that we should be able to at least mitigate that. And we're in the hospitality business, so automatically we want to make people feel good. That's our whole goal. So what we talked about was, if something like that does happen, then we would ask the customer, hey, you're under the weather. If you're having respiratory symptoms, we're going to ask you to leave, and we're going to what I told them is like, hey, we'll buy their food, get the food to go, but let's get them out of the building so that way it doesn't compromise the health of everybody in there. We've also, our hostess, the person that greets you when you walk in the door, we've asked for them to be vigilant as well when they come in, that if they're unsure about somebody, to raise the concern with the manager and allow the manager to deal with that situation.
Right. So, yeah, two related questions on that. Repercussion, should a customer not agree with our policies? Angry customers when, I'm sorry, let me be more complete. We get angry customers when we ask them to follow our mask policy. So you're a private establishment, you're not a governmental facility, you have the absolute right to enforce lawful policies. And there was something, I think, on YouTube recently, someone was somewhere was spouting off about their First Amendment rights. You don't have the right to go into a private establishment and not follow that establishment's policies and procedures so long as they're lawful. Again, this is not an unlawful policy, of which there would be many examples, of course, from history. But wearing a mask, washing hands, you can even, again, like I said, you can even take temperatures if you want. Different ways to take temperature. I would recommend the forehead scan. That's the easiest. But the legal answer is too bad. If you don't like the policy, I'm sorry you feel that way. But come back maybe when you feel that things are safer, or we'll contact you when we're no longer implementing our mask policy, and then you can come back. But no, the risk of the expense associated with offending that customer compared to the cost of other people getting sick potentially in your establishment is much higher. So I'm not concerned about that whatsoever. And then another question is, how should we approach a customer if they are not following our protocols? What do we say to them? Doug, you want to?
Well, for us in the restaurant, it's a little tricky because, they're eating, so they're not going to be able to eat and wear a mask. But I think that if you come from a good place and, just say, hey, that's our policy, I see it a lot. I wear my mask when I'm not, even here in the restaurant, I wear it all the time. But even when I'm outside of the restaurant and I'm going somewhere, I wear it. And I do see a lot of people that completely disregard wearing masks. And I think that the reality is that they're not taking personal responsibility, whether it's denial, whether whatever it is, for what they think that it's okay. And for me, I think that I rather be cautious and wear these masks to prevent the exposure, as well as potentially giving it to somebody else. So it is a hard situation, and there's really no right or wrong. As long as you come from a good place and you present in a way that you're coming from a place of understanding and compassion, if they turn around and get sour, I'm sorry, there's the door. Not that I would say it that way, but you said, I'm sorry that you feel that way. Obviously, we're not going to be able to meet, fulfill your needs here. Maybe you should go. And if you want to stay, you're more than welcome to stay. We love to have you, but these are the rules. And, we're not going to argue with the CDC on this stuff. I'm not an expert, and neither are they.
That's a good point. You can always punt to the CDC and their guidelines in enforcing policies and procedures. So again, you're not doing something that 99% of folks are not otherwise doing. So it's a completely reasonable policy. But I do think that the owner should educate all staff on what are we going to do if we see a customer not following our policy, so that there's uniformity. Because Doug's going to get busy, or he may not be there, and you're going to have inconsistent application perhaps. So everyone's got to be on the same page How are we going to deal with this? Because it doesn't, again, I talked about having a policy that you're not going to follow, intentionally or unintentionally. So if you're going to have the policy, this is what we're going to do, you got to be prepared to enforce it.
So I have another question that came to me privately that asks, can employers require employees come back to work? If work can be reasonably completed remotely, can employees be let go if they aren't willing to come into the office?
So ask the first part again, please, Melissa.
Can employers require employees come back to work?
If they want to remain employed, yes, so long as there is no risk, and this is the rub, that there's no risk of contracting COVID at the place of employment. So if you've got a large establishment and there's any indication there has been an infected worker or an infected customer, and provided that employee isn't home, for an example, taking care of a family member or a son or daughter whose school has closed as a result of COVID. So the list is lengthy, but so long as those exceptions don't apply, yes, you can have someone come back. I mean, after all, they are still your employee.
Okay. There is another, oh, go ahead.
And the second part of the question was?
Let me scroll back up to that one real quick. If work can be reasonably completed remotely, can employees be let go if they aren't willing to come into the office?
Again, if there is a risk or concern related to COVID exposure, it can't just be apprehension, right? So there's got to be some basis in fact of a positive case, or some kind of other risk involved. If an employee, if I understand the question right, if the employee wants to work remotely, but that's not a condition of employment, then no, remote work is not an option. But for an example, we worked remotely here at my office, not because we had a COVID concern, but because we were able to. So we chose to, but it wasn't mandated. And I'm sorry, this is taking these on the fly can be challenging. But what was the part about letting someone go, Melissa?
It says, can they be let go if they aren't willing to come into the office? So if they are able to complete their work remotely, but I'm assuming the business still wants them to come in, are they able to be let go if they're not willing to come into the office?
Yes, they can be let go, so long as it's not in retaliation for unemployment on reduced hours, so long as it's not in retaliation for using paid sick time, or some other retaliation, then yes.
That also raises another question too. If a person has what they consider the risk factors of COVID, and then they're asked to come into work and they're not doing social distancing or safety measures, they could potentially have a legitimate case if you do lay them off and they have these underlying conditions that the employer cannot guarantee their safety. Would that be correct?
Yeah, so that there are gray area scenarios, where you do have someone in that situation where you may want to take the high road with them and not terminate, or find a way to furlough them without terminating, or more carefully manage that particular scenario. So those are kind of case by case scenario.
All right, and before I read the next question, I wanted to make sure, do you guys have more that you would like to talk about before I ask this one, or?
Go for it.
Yeah, go for it.
Okay, all right. So this one says, I own a photo.
I got more. Sorry.
Gotcha. And this one was asked in the chat. I'll read it out loud, but if you need to go back and look it over, you can definitely do that. So Jesse asks, I own a photo booth company and we've received inquiries for non-staffed rentals for events and non-staffed leases for venues. While our clients sign extensive agreements, guests currently only approve a legal disclaimer on the photo booth screen. My concern is even if we share our global pandemic risk mitigation policy for best practices, if we don't have staff that we can control whether guests will not touch the photo booth screen, the stylus pens, for rentals, or our client will take recommended preventative measures or for leases. Do you have any recommendations for what we can do to protect our business from being liable for guests and or clients we can't control at events or venues? Hope this makes sense.
It does. Let me, that's a very unique question. Let me read it quickly one more time.
And then while you're reading that, Matt, Doug, there's another question. This could relate to both, but the question is short. It says, would you recommend posting mask policies at the office? So Doug, do you have mask policies posted anywhere, or is that a recommendation?
No, it's mandatory for all staff to wear masks while they're working. You know, when we first decided to do this, we said it's going to be adamant that everybody wears the protective mask to be able to perform the work. And if they don't come into work with a mask, we'll provide them with one. But once we give them their 3 masks that are reusable and washable, then it's part of the uniform. So it's in our uniform policy now as far as COVID response. So it's in there, and we will take corrective action. We've actually have had to give correction action to somebody who was not a believer that this was even real. So we're like, sorry, bro, we got to do it, and was not very happy about it.
So yeah, there is no bright line rule, what I would say, as to a mask policy or the type of mask. It's very dependent on the volume, the foot traffic you have, volume of clients, et cetera. So we in our office, we don't see, our clients don't visit us as often as we'd like, perhaps. So we're just staff here. And so we don't wear masks typically, but we're also not very close to one another. So again, it's case by case. But when we get off this call, I've got a meeting where we're having several people in the office, and I emailed them just yesterday and said, hey, everyone bring and wear your mask. And so when we've got certain people in the office where we're not able to control the flow as well, we will implement a mask policy. Yeah. So to Jesse's question, the photo booth. So I think the scenario is, you know, someone's getting married, they want to rent a photo booth from Jesse. So you've got the clients there, which is the married couple, and then you've got the wedding guests, and everyone's interacting closely with the photo booth and touching each other or whatever people do at weddings. And I think that's a really hard risk to mitigate, Jesse. And I would argue that, well, what I would do in that sense is you're having your clients, the married couple in my hypothetical, sign a waiver absolving you of any liability, kind of back to the lodging hold harmless question. It's marginally enforceable, but it's helpful. It's telling them what you expect of them. But I think the claim against you, because you have no control over that scenario, the claim against you is weak to non-existent. Really, again, from the causation standpoint. So there's a break in the chain of causation in legal terms. So in that sense, if guests contract COVID at that wedding, and the claim is going to be against the married couple saying, you know, you shouldn't have had this photo booth, which is an attractive nuisance, which invites people to be close to one another. So Jesse, I think you're good as long as you got that waiver.
And the other thing too that I just thought about, could you mitigate some of the liability if you show that, hey, you know, our equipment gets cleaned when it's delivered, and then after it's delivered, we clean it. Here are our logs on that, and it was cleaned.
Absolutely.
Before and after.
Absolutely. You're documenting it. You're putting that in the waiver. You're having the married couple acknowledge it. All of that. You're exactly right.
Cool.
All right, so that is as far as it goes for questions. That was quite busy in the chat room. If you have any more, you can still drop it down, or just unmute yourself and you can ask your question or ask for clarification. That's totally fine.
We'd love to see another face, you know. I mean, I like looking at Doug, but you know.
Thank you. That's very nice of you.
All right. So I guess while we await questions, and please do ask, I think we're going to have a wave of claims upcoming related to unemployment. So, you know, the CARES Act expanded that immensely, as everyone knows. That's going to come to an end. It may be expanded. So that's the other issue, is what we're talking about today may become stale in a week, or in 2 weeks. That's what makes this really challenging. It drives lawyers nuts because it's hard to counsel clients, especially on the standard of care. What's standard of care for maintaining best practices? So that's a moving target. But I see claims coming from unemployment. If nothing else, you've got employees who are frustrated. They can't get through to DES. Their claims aren't being processed. It's easy to take out those frustrations on the employer. And Doug raised a great point the other day about you're fending off these claims, or you're seeing these unemployment claims from employees all over the place, including former employees. And so that's something from a planning standpoint you have to be mindful of. Although I will say that, and I don't know if anyone's aware of this, but they probably are, but from one of Governor Ducey's executive orders, the order stated that claims filed while the executive order was in place, unemployment claims, will not be charged against the employer's account. So that's a very important distinction. Again, with the idea in mind of not tanking employers for doing the right thing during this pandemic. So, you know, and again, there may be another stimulus package coming. There's been talk of that. And I think some of that will track with whether there is a second coming of COVID or whether we're in it now. We really don't know.
All right, so at this point, there haven't been any more questions asked. So I just want to remind everybody here that's participating that if you do have questions that maybe come up over the weekend, this video will be posted to the Local First website. So I'll be sending a link to that YouTube video as well as contact details for Matt. So if you have questions, just let you know. Oh, oops, Tara has a question. Go ahead and drop it, or just unmute yourself, Tara, and go ahead and ask it.
Hi, thank you so much. So we own a local fitness studio in North Phoenix, and one of the things I'm looking at now, we've been opened now in our 4th week on a very limited, scaled back atmosphere. And I'm just kind of thinking about the future, and if our business can't recover from this and we have to essentially close the doors, is our only kind of recourse to file bankruptcy to get out of our lease. Like, I'm just trying to think of, you know, and just be smart about this.
Right. Well, I certainly hope you don't. And I would say that actually dovetails into the last point I'll make, and that is private contracts. So we had a moratorium end on small business evictions. Those are now hot and heavy again, and actually we're counsel to a number of those claims. You may be, and then you get the issue of did you sign a personal guarantee on your lease? Presumably your LLC or your corporate entity is the tenant, but if your landlord is unwilling to negotiate with you or let you buy out of the lease or renegotiate the lease, then you may be forced down that path. I certainly hope not. But what you're driving at is a great point, which is this is the time for renegotiation with employees. We've modified more employment contracts than I can count. So renegotiation with landlords. Listen, if I'm representing a landlord, I would tell that person, you do not want to chase anyone in bankruptcy. You don't want pennies on the dollar. So renegotiate the damn thing if you have to. And so you've got a lot of leverage right now. That's the upside to this, is the leverage on contracts, and whether that's a lease, whether it's a vendor agreement. We represent a lot of breweries, so if it's a hops agreement, whatever, you've got leverage now to do that. You may not have it again, and whether you're talking about using this as an opportunity really to make your staff lean in a way that wasn't lean before. You should be doing some of these things now, so right now, as far as private contracts go, private leases, it's got to be renegotiated, or else you've got to fold, unfortunately.
Yeah, I had that same concern, Sarah. So I went to my landlords when this happened. I said, look, I don't know what's going to happen. Obviously, I mean, I've paid rent. I've never missed a rent payment. I've always paid it on time. And it's more about relationships that you have with your landlord. So with one landlord, he was like, hey, Doug, you know what? Like, at the end of the day, I know this is not in your control. I'm going to work with you. I want you there. If we have to modify the lease, I want you in there. So even if you have to pay me half the rent until this figures out, then I'm willing to do that. And my other landlord, he was like, hey, Doug, it was the same thing. You know what? We get it. We know what's going on. So unless your landlord is really a bonehead, pardon my French, even though it's not French, most of them are willing to work with you. And Matt's right. Like, act now before it's too late. Raise those concerns. Just have some stipulations going, and the lines of communication with your landlord. I talk to my landlords at least once a week and tell them what's going on, and to do that. And the reality is that if your landlords are smart, we're in a recession. We're in the middle of a pandemic. There's a lot of social discord right now. So if there's ever a time that you should take advantage of this, is now, to position yourself to protect yourself from ever going to bankruptcy. That's the last thing you want to do, because it does have a negative outcome for you in the long term. So I would avoid those things as much as you can. That's just my 2 cents on that.
That's great. Thank you so much, you guys.
Yeah.
It's our pleasure. I don't have, you want me to sign off? The last blip is look at your coverage policies, your insurance coverage policies, to see if you've got business loss interruption coverage. If you don't have a virus exclusion, you may have a claim there. So we filed several lawsuits against carriers for not honoring policies. So everyone just keep that in mind.
I had a question about that too. If there is a virus exclusion on that, when it comes time for renewal on your insurance, can you say, I don't agree with this, and cross it off? And if because obviously I have every right to do that. And I say, and then if they say, no, we're not going to give you a policy, obviously we have to just either find another carrier that doesn't have that policy in their policy, or just live with it.
Right. So you'd have to have that conversation to strike that clause, that endorsement in the policy. I can tell you no carrier, I mean, you've got national law firms devoted to only these claims now on behalf of carriers. So this has got their attention, of course, unlike anything probably has in the past. Well, the last thing would be SARS a few years ago. But you're not going to find a policy without that language now. And if you try to exclude it, they're going to say, sure, we can exclude it. It's going to be an unenforceable. It's going to be it'll be a policy you just can't afford. So it'll be too expensive. So I don't see those policies existing anymore. Not now.
Yeah. Huh.
So Doug, if you go shop, you can try to shop around, but I would be shocked if you find such a policy.
Yeah. Well, sounds
So,
like
yeah,
it.
it's
Sounds
unfortunate.
like somebody needs to lobby against the insurance companies.
Well, right. We were waiting for Governor Ducey to do what many other governors did do and say, listen, this virus has caused direct physical harm to property that can trigger coverage. But he didn't do it.
Next time.
Next time. Yeah, well, yeah. Let's see.
Yeah. Okay. Cool.
That's all I have.
Me too. I'm good.
All right, perfect. Well, we'll go ahead and wrap this up then. And just to remind everybody, this webinar was recorded. So it will be posted on the Local First website probably on Monday, which is also when I will be sending out the email with the link, and then also with Matt's contact details if you have any further questions that do come up about this.
And if anybody out there that like is in the hospitality business, or if they want any of our SOPs or anything that we like what we're doing, please reach out. I'm more than happy to share any of that information for anybody that wants it.
Awesome. Thank you so much to both of you for taking time out of your day to do the webinar. We really appreciate it.
Thank you, guys.
very much. Great
Have a good
information.
weekend, everyone.
Thank you.
Take care.